empowering pharmacists to support tobacco cessation in Europe. In the European region, 25.3% of people aged 15 years and over are tobacco users. And given the global and regional prevalence and burden of tobacco use, particularly as a risk factor for non-communicable diseases, it is important that the role of pharmacists in tobacco use prevention and cessation is expanded and consolidated. Today, you will learn about the burden of tobacco use in the European region and the role that pharmacists can play in tobacco cessation. The event will include insights from the World Health Organization, country examples of pharmacist services, and the representation and presentation of FIP resources to advance tobacco cessation through pharmacists. For those of you who don't know me, my name is Lars-Åke Söderlund, and I have the honor and pleasure of moderating this event today. I am one of FIP's vice presidents, and I'm also co-chair of the FIP Technology Advisory Group. And on a daily basis, I work as an executive advisor for Apoteket, a government-owned pharmacy chain in Sweden. As you can see on this slide, we have some announcements. Please note that this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. And to all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage all the questions so that at the end we will be able to address those questions. And of course, you're welcome to provide feedback to webinars at fip.org. And I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists worldwide. And if you are a pharmacist or a pharmaceutical scientist and you would like to become a member, please register on FIP's website at fip.org. For this event, we are joined by the panel of fabulous speakers, and I want to sincerely thank each and one of them for taking the time to prepare their presentations. And with us today are Dongbo Fu, Medical Officer for Tobacco Cessation from the World Health Organization in Switzerland, Ines Nunes da Cunha, Practice Development and Transformation Projects Manager at FIP, Monica Condino, Pharmacist from the Acompanhamento Farmacoterapeutico in Portugal, Fiona McIntyre, Policy and Practice Lead, Scotland Royal Pharmaceutical Society, UK, and Björn Wagner, Industry Pharmacist from the Chamber of Pharmacists of the State of Berlin, Germany. Welcome, all of you. And here we have today's program. Our invited speakers will cover the following topics: the burden of tobacco use and implementation of tobacco cessation policies across the WHO European region, tobacco cessation services provided by pharmacists in Portugal, and tobacco cessation services by pharmacists in Scotland, as well as in Germany, and a presentation of the FIP resources to empower pharmacists to support tobacco cessation. And of course, as mentioned earlier, we will have a Q&A session and a wrap-up and conclusion of this event. There are a number of learning objectives for this event today. It's about to learn about the burden of tobacco dependence in the European region, the importance of leveraging pharmacists for tobacco cessation in the European region, showcase examples of tobacco cessation services provided by pharmacists in the European region, and of course, to identify the FIP resources to empower patients to support tobacco cessation. Now I have the honor to introduce the first speaker, who will be presenting on the burden of tobacco use and implementation of tobacco cessation policies across the WHO European region. Dr. Dongbo Fu is Medical Officer for Tobacco Cessation in the No Tobacco Unit, Department of Health Promotion at the World Health Organization. Dr. Fu has over 15 years of international country-level experience in tobacco cessation and treatment of tobacco dependence. He is the WHO's principal focal point for providing technical leadership in working with the WHO member states to establish and strengthen their national tobacco cessation and treatment systems as part of a comprehensive tobacco control strategy and part of the Universal Health Coverage Intervention Package. Dr. Fu has coordinated the development of WHO's clinical treatment guideline for tobacco cessation, a series of WHO technical tools for integration brief tobacco interventions into primary care services, and for developing and improving national toll-free tobacco quit line services. Dr. Fu studied medicine and received his degree from Yangtze Medical College, China, and he also holds a PhD in preventive medicine and a Master of Public Health, both from the School of Public Health, Fudan University. It's a great honor and pleasure to have you as a first speaker today. Welcome, Dr. Fu, to give us your presentation.
Thank you, Lars, for your nice introduction. Good afternoon, good morning, good evening, everyone. So it's my great pleasure to be able to join this digital event on empowering pharmacists to support tobacco cessation in the Europe region. And I'm going to focus on, as Lars mentioned, we'll focus on sharing the burden of tobacco use in the region and also the current implementation status of cessation policies in the Europe region. So let's start with the global burden of tobacco use first. According to WHO's global estimates, which was published this year, there's a report called the WHO report on the trends in the prevalent tobacco use 2000 to 2030. So you can find all the information from that report. So you can see here, according to WHO estimates, in 2022, 1 in 5 adults are the tobacco users. And look, the males, the prevalence of tobacco use among the males is around 34%, which is more than 4 times the rate for the females. So that's the global situation. Let's look at the burden of tobacco use in different WHO regions. You can see here the purple line represents the change in prevalence tobacco use in the European region, WHO European region. You can see here the current situation is the European region has the prevalent tobacco use among adults, here mainly aged 50 years or older, is about 25%, which is second only to the highest rate in Southeast Asia region. And then if you look at the trend, if the current tobacco use patterns continues, it was estimated that in 2030, European region will have the highest prevalence of tobacco use among all WHO regions. As you can see, this is the situation why we need to strengthen our tobacco control efforts in European region in order to avoid to become the region has highest prevalence of tobacco use by 2030. Let's look at the smoking rates in each individual country in the European region. You can see here, this is also the information from the WHO global estimates. You can see here we are looking at only the current tobacco smoking rates among the adults. From this chart, you can see majority of the European countries are having current tobacco smoking rates more than 20%, which is represented by the blue and the red bars. And 14 of them have their tobacco smoking rates higher than 30%. So this is the situation. It means almost every country have a high burden of tobacco smoking in the European region. Now, in summary, just want to use the total number of tobacco use to summarize what's the situation in WHO European region. In summary, the WHO European region, in terms of the total number of tobacco users, they are in the middle ground among all 6 WHO regions. It was estimated that they have around 180 million tobacco users in 2022. And the European region is very much different from the other 5 WHO regions. There are high number of tobacco smokers among females. So in 2022, it was estimated the European region have about 65 million female tobacco smokers. So this is a unique situation, or this should be really prioritized when we planning the tobacco cessation work in the European region. Now let's look at the current implementation status of cessation policy in the European region. According to WHO's 2023 global report on the global tobacco use epidemic situation, you can see the empower measures implemented by the end of 2022, the situation in the global level. And here we also have the situation of WHO European region to be showed here. According to our report, by the end of 2022, globally, we have 32 countries are implementing the policy all of the Empower at the highest level of achievement, representing 16% of all WHO countries in the world, WHO member states in the world. And then among these 32 countries, 11 of them are in European region, representing 21% of all WHO member states in the European region, which I highlight in red. And then let's look at situation in individual countries in the European region in terms of the current implementation status of policy all. You can see here, in addition to the 11 countries who already implement policy all at the highest level of achievement, majority of the countries, 66% of the WHO member states in the Euro region, they are implementing the policy all at the moderate level of achievement. In other words, almost every country are facing the challenges to provide cessation support to reach large number of people in their country. So the reason why they're not able to provide comprehensive tobacco cessation services is because almost every country are facing some common challenges. I'm sure all of you are aware about that. Just want to quickly review them. For example, in many countries, people still doubt whether the efficacy or cost effectiveness of cessation intervention are really high, whether this is something is valuable to put the resources in, or whether the country need to investment to provide the investment in this area. So I think the answer is yes, but many countries still doubt for that. The second challenge means every country, as we just mentioned, are facing a large number of people need our support. In the worldwide, about 65% of the population have no access to comprehensive tobacco cessation services. In each country, we are talking about the millions of tobacco users who have no access to appropriate tobacco cessation service. So that's another challenge. We are facing the same challenge. We need to serve a large number of people. And then in many countries, they're not providing the cost coverage for tobacco cessation services for those who using the services. In many countries, our cessation services are not responsive to vulnerable groups. In European region, this is something we need to pay a special attention. For example, we have a large number of female smokers, but currently the service is really focused on serving people in general, or serving the general population. And then very few countries are carrying out regular monitoring evaluation to help the country to improve their cessation services. Last, I think all of you are aware that new and emerging nicotine and tobacco products are also posing the challenge, especially the misinformation by the tobacco industry. But also at the same time, in order to help us put in place comprehensive tobacco cessation services, we also have some opportunities existing in almost every country. For example, if we adopt an integrated approach, promote tobacco cessation support as part of a comprehensive tobacco control program, and also as part of essential component of universal health coverage, this can help us achieve what we call synergistic effect. We're able to leverage the different intervention which already existing or implementing at the country level, able to help us establish cessation services. Another opportunity is we really need to consider how are we going to set up a sustainable source of funding for tobacco cessation support. Some country able to have some part of tobacco tax to be used to support cessation services. And then in order to reach large number of people, as many as possible, at the lowest cost, we need to prioritize population-level tobacco cessation approach, such as briefwise as part of a routine practice in primary care, national toll-free quitline, and using the digital cessation tools to help reach large number of people. So innovative approach can really help us improve the reach of cessation services. And then monitoring evaluation is very important. We need to put in place in order to help us to check whether the process going well as planned and whether we're able to achieve the target as we set in each of country. How are we going to improve our cessation program? Lastly, we really maintain caution where new or emerging tobacco and nicotine products are concerned, especially really pay attention to the misinformation disseminated by the tobacco industry. Okay, at the end, I would like to emphasize advancing cessation support should be everybody's business, including pharmacists. Pharmacists actually can play a key role in helping tobacco users quit, because as the statement by our former WHO Director General, Dr. Li Junwu, in 2005, during our World No Tobacco Day in 2005, emphasized, similar to other health professionals like doctors, nurses, midwives, pharmacists can actually helping people to change their behavior, because collectively they are able to speak millions of people a year. So in summary, pharmacists really have the great pleasure to play a key role in how to help tobacco users quit. And I really strongly recommend everybody just spend a few minutes as part of our routine practice and to ask and advise people who are using tobacco to quit. Okay, just want to end here and happy to answer any questions. Thank you very much.
Thank you so very much, Dr. Fu, for this very interesting overview of the current situation and the challenges that lie ahead of us. It's a real challenge, as you said, as Europe within a couple of years, if we don't do anything more, will have the highest prevalence of tobacco users. And as you said, almost every country in Europe has a high burden of smokers. And knowing how it affects the non-communicable diseases, this is really a call for action, even for pharmacists. And also you mentioned the tobacco industry, and I recently learned how they actually interact directly with young people via social media platforms, trying to make them start to use their products. So we really have serious challenges ahead, and we need to actually mobilize everyone to support the tobacco and cessation services, etc. So let us now move on to our next speaker. Our Monica Condino is our next speaker. And Monica Condino is a pharmacist and has a PhD in pharmaceutical sciences. She is an invited assistant professor at the University of Algarve, Portugal, and also as a researcher at the Algarve Biomedical Center Research Institute. She is also a pharmacist at the Accompagnamento Farmacoterapeutico, a private company that provides pharmaceutical services in community pharmacies on an outsourced basis. The floor is yours, Monica. Welcome to give us your presentation on tobacco cessation services by pharmacists in Portugal.
Hello. Hello, everyone. Thank you very much for the kind introduction, and thank you, FIP, for this great opportunity. I would just like to say that the data I'm going to present and the strategy I have developed are the result of part of my work in the community pharmacy in the field of tobacco cessation. Looking at tobacco addiction in Portugal, according to the last National Health Survey from 2019, 17% of the Portuguese population aged 15 and over are smokers, of whom 23.9% are men and 10.9% women. As you can see in the graph in the right side of the slide, 17% is a lower prevalence of smoking than the previous data from 2014, which was 20%. And it's also lower than the European Union data. However, there is still a lot to do. In Portugal, 11.7% of deaths in 2019 were caused by tobacco. Almost 14,000 people, it's too much. As you know, Portugal is a signatory to the WHO Framework Convention on Tobacco Control. And despite some progress in controlling and protecting people from tobacco smoke, in practice, there is still much room for improvement in the provision of help to stop smoking. Here, free smoking cessation counseling is available through the National Health Service, but it is insufficient to meet needs. We believe that the expertise and accessibility of the community pharmacist can make a very important contribution to promoting tobacco cessation. Having made this initial approach, what are the tobacco cessation services provided by community pharmacists in Portugal? So, in fact, the provision of these services is heterogeneous and varies greatly from one pharmacy to another. Some pharmacies have structured very brief and brief advice, others stick very brief advice, and still others offer an intensive support for smoking cessation in addition to brief advice. However, the implementation of these services, especially intensive support, in a systematic and continuous way is very low. There is also a lack of documentation of interventions. So, the barriers to the implementation of clinical services in the community pharmacy and special tobacco cessation services are well identified in the literature, namely the lack of training, the lack of knowledge and skills, the lack of time, the lack of remuneration, and the pharmacist mindset, which is very much focused on the medicine and not on the person's health needs. To try to overcome these barriers, we developed a strategy to ensure the provision of a comprehensive and structured tobacco cessation service. We designed a service to be implemented and developed by the pharmacy using an external pharmacist specializing in tobacco cessation. The service was structured according to the recommendations of our health authorities. So, our strategy has two steps. In step one, the external pharmacists train the pharmacy team in very brief and brief advice based on the 5A model. And the aim of this step is to identify opportunities for intervention in tobacco cessation and to identify the target population for the service, that is, smokers who are motivated to quit. In the second step, the external pharmacist implements the smoking cessation follow-up program through structured consultations. However, how does this strategy work in practice? So during the pharmacy daily activities, smokers age 18 or over motivated for tobacco cessation are invited by the pharmacy team to join the intensive program. Those who accept join the program by signing the informed consent. Our follow-up program lasts 1 year, as recommended by the Portuguese health authorities. After the first consultation, further appointments and phone contacts are scheduled according to the person's progress. And the D-Day usually takes place after the first or second consultation, as you can see in the figure in the right side of the slide. Abstinence is assessed at mounts 1, 3, 6, and 12 and confirmed by measuring carbon monoxide less than 5 ppm in exhaled breath. So, looking at the first consultation, the structure of the first consultation involves the pharmacist asking about smoking habits, assessing the smoker's profile, motivation, and dependence status. For motivation, we use Reisman test, and for dependence, we use Fagerström test. The pharmacist also evaluate the presence of other health problems, including signs and symptoms of anxiety and depression, and the social and family environment. For the evaluation of anxiety and depression, we use the Generalized Anxiety Disorder Scale and the Patient Health Questionnaire 9, respectively. Also, during the first consultation, several health parameters are assessed by the pharmacist, including body mass index, body fat, waist circumference, blood pressure, and carbon monoxide. Spirometry is also usually carried out. After the pharmacist assessment, a personalized therapeutic plan is agreed with the smoker, including pharmacological interventions and behavioral and motivational support. If necessary, the smoker will be referred to a doctor. In the subsequent consultations and phone contacts, the pharmacist evaluates the treatment plan, determines the relevant health parameters, and adjusts, if necessary, the treatment plan to prevent relapse or promote tobacco cessation, or makes a referral to the physician. Looking at our results, I'm only presenting the data available to me, as we were unable to process the results of my 6 colleagues. The results I'm presenting cover, therefore, the period from September 2009 to April 2023. So during this period, 152 smokers were included. The majority, 57.2%, were male, with an average age of 48.1 years, and each smoker received an average of 3.4 pharmaceutical consultations and 3 phone contacts. Related to previous attempts to quit tobacco, 75.7% of the smokers had made at least one attempt to quit smoking. If you look at the right side of the slide, the majority of the participants had moderate or high motivation to stop tobacco and moderate or high dependence, nicotine dependence. Regarding the treatment plan used, so almost all smokers received motivational and behavioral support, and 133 accepted pharmacological therapy. Of this, the majority, 119, received nicotine replacement therapy. As you can see in the graph in the left side of the slide, among smokers who used nicotine replacement therapy, oral forms, which means short-acting forms, were the most commonly used option for 49.6% of smokers, followed by combination therapy, which means short-acting form plus patches, used by 31.1% of smokers. Among non-nicotine therapies in the right side of the slide, cetirizine was the most commonly used option, although it has only been available in Portugal since the end of 2021. I think it's important to note that with the exception of varenicline and bupropion, pharmacists in Portugal can recommend all first-line treatments. As far as the abstinence rate is concerned, 82 of the 152 smokers had a D-day. At the end of the first month, 71 were still abstinent, which means 46.7%. However, the success rate dropped to 32.2% at the end of the third month, 27.6% at the end of the 6 months, and 20.4% at the end of the year. Among other results published in the 2021, we evaluate the determinants of success in our smoking cessation progress. And we found that smokers who had more appointments with a pharmacist had higher success rates compared to smokers who had fewer sessions with pharmacists. On the other hand, we also found that our success rates, even at 12 months, were higher than the many studies published in the literature. We believe that this may be related to the accessibility of the community pharmacists and their willingness to regularly reinforce interventions to help maintain abstinence. So as conclusion, this strategy of promoting tobacco cessation through an outsourced pharmacy service is feasible, leads to very significant and motivating success rates in the context, and allows Portuguese community pharmacy to overcome the main known barriers to implementing clinical pharmacies. We also think that the provision of the tobacco cessation service by a highly specialized and trained pharmacist focused exclusively on this activity could also contribute to the success of the strategy. And thank you very much for your attention.
Thank you so very much, Monica, for this interesting presentation about smoking cessation services in Portugal. I actually found it very interesting to see that smokers start at the age of 16 and they continue to smoke on average for 31 years. And that means that they are actually victims of, you can say, non-communicable diseases as well. And I also think it's very interesting to see how the combination of different, you can say, strategies and therapies are important in order to have a successful smoking cessation service. Thank you so very much. It is now time for our third speaker, Fiona McIntyre from Scotland. Fiona joined the Royal Pharmaceutical Society in 2023 after a career in the National Health System Scotland. And with over 20 years of experience in secondary care, she is a dedicated registered pharmacist, and her passion lies in patient safety, fostering system thinking, and promoting a culture of continuous learning within the professional community. Welcome, Fiona, to give us your presentation on tobacco cessation services by pharmacists in Scotland. The floor is yours.
Thank you very much. Thank you very much for such a warm welcome. It's a pleasure to present to you today. Thank you for the invitation. So in Scotland, our population is 5.4 million people, and the diagram on the right-hand side here is a map of Scotland and our islands. The National Health Service is split up into 14 territorial boards, and these are further split into 3 regions. Now, I'm speaking to you today from the east of the country in the darkest blue section of the map, in just outside a little town called Bathgate, about 25 miles west of Edinburgh. So as I say, Scotland has a population of around 5.4 million with an ageing population. Smoking tobacco remains the single largest preventable cause of death in Scotland, with almost 8,300 smoking attributable deaths annually. Although smoking rates have been falling since 2003, these reductions hide a widening difference in smoking rates between the most deprived areas and the least deprived communities, a smoking prevalence of 24% in the most deprived areas compared with 7% for the least deprived areas. In adolescents, the prevalence of e-cigarette use is increasing, and data shows that 3% of adults now use e-cigarettes as well as smoking. Reducing the harm from smoking is a public health priority in Scotland, and Raising Scotland's Tobacco-Free Generation was launched by the Scottish Government in 2018 with a roadmap to and target of 2034. In 2024, following a four-nation consultation into tobacco use and vaping, a UK-wide bill on tobacco and vapes was due to be progressed through Westminster, and this is currently paused due to the recent general election last week, and we anticipate that the new government will move forward with this bill. There's a plan to take stock of the current situation in Scotland relating to e-cigarettes, including the rise of vaping in young people, and establish a way forward that protects children and non-smokers, while also being cognizant that they are one potential route towards stopping smoking for adults. E-cigarettes are not available to be prescribed for people who wish to stop smoking in Scotland. The Scottish Parliament has a cross-party group improving Scotland's health. The purpose of this group is to have a solutions-oriented focus on how to improve the health of the people of Scotland, primarily by reducing the health harms caused by, amongst other things, tobacco. The Royal Pharmaceutical Society is a member of the group, and we also partner with the charity Ash Scotland to ensure up-to-date information is available about the smoking cessation services available to the public through community pharmacies. The Royal Pharmaceutical Society are active in professional leadership in this policy area. We responded to the UK Smoke-Free Generation consultation last year, as well as multiple consultations from the Scottish Parliament on their bill to ban single-use vapes. We've developed a policy on e-cigarettes, and our president recently wrote to the Times newspaper describing the harms of e-cigarettes in children, but also recognised the role that e-cigarettes might play in supporting adults to stop smoking. We also have resources for pharmacists delivering smoking cessation services, including audit materials. Now, this poster is an example of the materials published as part of the public health service provided by community pharmacies. The smoking cessation service forms part of the core offering of the community pharmacy contract commissioned by NHS Scotland. Displaying a poster around about January to March of every year raises awareness of the smoking cessation services available through community pharmacies. So Quit Your Way is the name of the service that's used across NHS Scotland. And since 2009, 70% of all stop smoking attempts have been delivered through community pharmacies in Scotland. And last year, just over 18,500 people accessed community pharmacy services to stop smoking in the year 2022 to 23. Service users can visit their local pharmacy, where a pharmacist will explain the medications available to help them to quit smoking, such as patches, nasal sprays, gum, or inhalators. The advice provided is sensitive to the individual's preferences, needs, and circumstances. Specifically, they offer smokers who intend to stop structured face-to-face behavioural support involving multiple sessions starting at least 1 week before the target quit date and continuing for at least 4 weeks afterwards, generally on a weekly basis. There is a structured protocol to maximise delivery of all aspects of motivational and pharmaceutical advice, and a procedure for the supply of pharmacotherapy. So this is an illustration that I've shared that's been reproduced from NHS Lothian. This is an aid that is supplied to the community pharmacies in their board area, and that describes the brief intervention model that is used. The initial consultation is the point to establish that the patient is committed to a quit attempt. They are given advice, encouragement, and information to take away. Some may be motivated enough to receive a supply of nicotine replacement therapy at the first visit, while others will return within a week to receive their first supply. This extract from the support materials illustrates the formulations available for supply. There will be geographical preferences for which formulation is first and second line in each board area, dependent on their local formulary. Pharmacists and trained members of their teams can have a consultation with people in the pharmacy or by other means of communication, and all interventions are recorded on the pharmacy care record, and these submissions are also linked to the payments at weeks 1, 4 and 12. The universal claim framework is used to gain reimbursement for products supplied. Carbon monoxide monitoring is also used, and it's mandatory at weeks 4 and 12. We know from part of our work to support the FIP point of care testing survey suggested that levels of carbon monoxide monitoring fell away during the pandemic, and they've not yet reached pre-pandemic levels. Before accreditation as a Quit Your Way pharmacy in a health board, pharmacists undertake an approved Quit Your Way training session. The smoking cessation training is compulsory for every community pharmacy staff member who wishes to be involved in the service, and is usually offered as a full-day introductory course. The training programme incorporates the National Education for Scotland Smoking Cessation Distance Learning Pack, and that's offered at regular points throughout the year. It's open to all pharmacy staff, including foundation trainee pharmacists and counter assistants. Pharmacies are asked to particularly encourage their locum staff to attend training, and staff are encouraged to attend refresher courses at least once every 3 years. Data published by Public Health Scotland at the beginning of this year demonstrated that the majority of quit attempts in the year 2022-23 utilised more than one type of nicotine replacement product. In Scotland, smoking cessation services are delivered at a local level by the NHS health boards and community pharmacies. And this diagram shows the variation in the geographical areas as to the proportion of services delivered by community pharmacies compared with the specialist services. Smoking quit attempts through smoking cessation services have been falling since 2011. Community pharmacy quit success rates are lower than specialist services, but are cost effective and have a higher throughput. Specialist services sit within general practices, community and acute care. They are more structured, include group sessions facilitated by a trained advisor or one-to-one sessions directly with a trained advisor. And the split of the services is shown in the diagram. Community pharmacies are often located in communities with higher health need. They don't require an appointment and have wide opening hours compared to specialist services. So future priorities and policy aims for the future. I think it's particularly important around integration with other health services. We need to strengthen collaboration with other healthcare providers to create a more cohesive approach for people who want to stop smoking. We need to utilise technology and think, how might community pharmacy teams interact with people who are on the journey to stop smoking, using digital reminders, messages, and also using tools to better track progress and outcomes. We want to be integrated with a single electronic patient record, which is not yet available in Scotland. And a recent study in the northeast of Scotland reported that people in least deprived areas reported lack of visibility of smoking cessation support, despite the location of community pharmacies within these communities. So we need to do more to raise awareness and improve access to people in these areas to the support that they need. And that was described by Dr. Fu in the first presentation today. So I'd like to thank you very much for your attention, and thank you for the invitation.
Thank you so very much, Fiona, for this very interesting example of successful tobacco cessation services by pharmacists and pharmacies in Scotland. And you are also right. I think looking into the future by using technology, etc., is a very important tool for us at the pharmacy as well, in order to reach out to the patients. It is now time for our next speaker, Dr. Björn Wagner from Germany. Björn studied pharmacy at the universities of Kiel and Heidelberg, and he received his PhD from the University of Marburg and an MBA from Quadriga University. He is a delegate and former vice president of the Berlin Pharmacists Chamber, and currently heads government affairs and access at Kenview in Central Europe. Welcome, Björn, to give us your presentation on smoking cessation services in Germany.
Yeah, hello everybody, and greetings from Berlin. It's a big pleasure, and thank you, Lars, for the kind introduction. I would like to take the next couple of minutes to talk with you all about tobacco cessation initiatives across Germany. So Germany is still in a very bad state when it comes to smoking. Still, about a third of the population smokes, and with a high amount of women, as we have heard, across the EMA region. This is particularly true for Germany, as one of the highest amounts of women smoke in Germany. You can see that this is also associated with high costs for the individual smokers, as well as with around about 67 billion euros, high burden also to the society. This is always reflected by the criticism of the WHO in regards to achieving the framework convention that Germany signed as a country. So, for example, the last cigarette increases in Germany are still below the inflation rate. So, in generally, smoking becomes cheaper. There is no national-wide smoking ban in gastronomy or public transport services. And that is, I believe, one of the core things to take into account is also a very high lack of effective prevention. So there's no ban of flavors and an alternative smoking products or nicotine products. There's no real advertisement bans at the point of sale, and no indoor smoking bans. This comes with a public challenge as well, because smoking is traditionally not a priority on the political agenda in Germany. It's still perceived as a lifestyle problem and not recognized as an addiction like alcohol or the other forms of drug usage. Today before, there's a strong lobby for tobacco products, or events. And unfortunately, smoking taxes are not utilized for preventive measures. So just a quick glance of what can be done. I have brought you an example from the Berlin Pharmacist Chamber of what pharmacists are, how we can empower community pharmacists to tackle this topic. So in Berlin, as part of the Pharmacy Goes to School projects, local pharmacists are, voluntarily sent to schools to give a wide range of topics on prevention and awareness to school children. Children and young adults are to be sensitized in dealing with medicines, for example, and educated about the risk hazards of drug use. And specifically, since 2015, there's a dedicated lecture on smoke-free available for teachers to choose from the curriculum. This aims, again, to create awareness about smoking in general, as well as the environmental burden of smoking already at an early age. It's a competition for a class, smoke-free class, that goes for a certain time for grades 6 to 8, and the class can win small prizes and certificates. For example, if the class says no to cigarettes, e-cigarettes, shishas, tobacco, or nicotine in any form. But there's also momentum from a policy point of view. So bear with me, these are a little bit complicated legal terms, but after all, this is for Germany. So there is a legal framework in Germany that medicines were primarily used to improve quality of life, so-called lifestyle medicines, are not to be prescribed to patients from statutory health insurance. So the statutory health insurance covers about 88% of the general population in Germany. And the so-called life medicines include drugs, for example, adipositors, hair loss, erectile dysfunction, but also, as here in this case, smoking cessation. But there's hope, as I said. So from the last political legislative, we have a bill, the Ministry of Health allowed the prescription of smoking cessation therapies for individuals with severe tobacco dependence that is then reimbursed by the SHI once every 3 years. So in Germany, this is a complicated process because this is only the federal political dimension, and it needs to be drawn out by the self-governing body. In this case, the Federal Joint Committee, the GBA, has been commissioned to regulate the requirements of smoking cessation programs, so the entire framework, and to publish a medicine product directive. So what they did first, and you can see that in the little graph and timeline below, is they commissioned a so-called IQWiC, which is the Institute for Quality and Economical Value in the Healthcare System, to carry out a benefit assessment. So depending on data, they looked on bupropion, cetirizine, nicotine, and varenicline, and they assessed the benefit against placebo. And they concluded in the end of 2023 that nicotine replacement therapy and varenicline have additional benefits in the treatment of tobacco dependence. And so they gave it back now to the GBA, and the GBA is now, as we speak, in the negotiations on the prescription of these two substances in a dedicated framework, in a guideline. So which doctor is to prescribe it, how psychological counseling, how is this all going to happen? And so the hope is that from 2025, from the beginning of next year, there is then the opportunity for prescribing these kinds of drugs for smoking cessation in a dedicated framework. So now you might ask, why is this important? So interestingly, at the federal legislative process, a draft has been issued for the so-called Healthy Heart legislation. The aim of this bill is to improve the early detection and treatment of cardiovascular diseases, and including smoking cessation measure. And so we find in this draft bill a specific focus on reducing nicotine consumptions. So the paragraph that I showed you that kind of structures the eligibility for a reimbursed smoking cessation therapy, this will now be extended if the bill comes through. And so no longer is it limited to severe tobacco addiction, but for general tobacco addiction. And it will be financed more frequently than every 3 years. One important step that is also mentioned there is that for SHI accredited doctors, there will be the option to issue a prevention recommendation, and therefore they will get remunerated separately from their typical services for the initiation of a smoking cessation program. And that will help for doctors to address patients more specifically on the burden of their addiction. So for the pharmacies, there's also a lot of new opportunities mentioned in the Healthy Heart legislation. So, for example, there is health assessments in pharmacy determined at the age of 25, 23, and 50 that are focusing on assessing lifestyle factors such as nutrition and smoking. And so the pharmacy is put into a consultation opportunity to provide advice on prevention and early detection of chronic heart diseases and tobacco-related illnesses. And for this, they will allow a new pharmaceutical service to be established. At the moment, we have 5 negotiated pharmaceutical service, and this will be an additional one coming into play, where patients insured will be entitled to claim an annual consultation to prevent tobacco-related illnesses at the pharmacy. And so for what's also very interesting in this bill is that for the first time, also pharmaceutical staff, technical assistances will be enabled to carry out these pharmaceutical services for smoking cessation. So with that, thank you very much.
Thank you so very much, Björn, for this interesting presentation from Germany, both showcasing the current situation in Germany as well as challenges facing the country as such. And it's also interesting how smoking is becoming cheaper in Germany. But I think it's excellent to reach out to the schools, as you mentioned, the Pharmacy Goes to School project, and also when it comes to the development of prescribing authorities for pharmacists, and also the policy development, and also to focus on different lifestyle factors at different ages. That is actually a very good idea. So indeed, excellent examples from Portugal, Scotland, and Germany. Let us now move on to our last but not least speaker. It's an honor to introduce our last speaker and panelist today, Ines Nunes da Cunha. Ines is the FIP Practice Development and Transformation Projects Manager, leading the FIP Practice Transformation Program on non-communicable diseases. She is the lead and co-author of the FIP publications Tobacco Cessation, a handbook for pharmacists, published last year, and this year, Pharmacist-led Tobacco Cessation Services, a global intelligence report. Welcome, Ines. The stage is yours.
Thank you very much, Lars-Åke, and thank you to all the colleagues who presented great examples of pharmacist-led tobacco cessation services in the European region. I think it is really inspiring to hear these different examples and to learn with colleagues from these different countries. It is today for me also a great pleasure to share with you the work that the FIP has been doing in the field of tobacco cessation and what pharmacists can do to help individuals to stop using tobacco. FIP has been working for several years in the field of non-communicable diseases, NCDs, and in particular tobacco cessation as part of our commitment to the World Health Organization Astana Declaration on primary health care signed in 2018. One of the ways FIP has been doing this is through our FIP Practice Transformation Program on non-communicable diseases. This program aims to provide tools and strategic support to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and also treatment optimization of non-communicable diseases for improved patient outcomes and health systems efficiency and sustainability. The program initial focus on the 5 disease areas that you can see on this slide: cancer, cardiovascular diseases, chronic respiratory diseases, diabetes, and mental health, but also on risk factors for these non-communicable diseases, such as tobacco use, because we know that tobacco use is a risk factor that can affect, but also trigger all of these diseases, in particular the chronic respiratory diseases, cancer, and cardiovascular diseases. So in addition to developing resources such as handbooks and knowledge and skills guides for pharmacists in each of these 5 disease areas, which are available on our website and also microsite, we also developed specific resources focused on pharmacist-led tobacco cessation services. This includes the handbook you can see on the left of the screen, and for pharmacists supporting tobacco cessation and tobacco dependence treatment, which was launched last year on World No Tobacco Day. But also the FIP knowledge and skills guide that you can see on the right side. And this guide describes the knowledge and the skills pharmacists need to provide effective tobacco cessation services. These two publications are available on our NCD microsite, ncd.fip.org. These resources are also available in Arabic, Chinese, French, Spanish, and Turkish. Also, last year, FIP launched a holding statement on the use of electronic cigarettes. As we know, these products are becoming more and more popular, especially among younger adults and teenagers, due to flavors and also strategies that make them very appealing, and also to a certain misperception of these products as being harmless to health, which is not really the case. So FIP has published this holding statement to inform about our position on the use of these products. FIP has also started to work at country level to support our member organizations, particularly in Jordan and India. We started to support these two countries because they have a higher prevalence of tobacco use, and Jordan in particular is one of the 6 countries in the world where prevalence of tobacco use was actually increased. And we have started with these 2 countries last year, but we will probably support our member organizations in other countries as well. On World No Tobacco Day this year, FIP and WHO issued a joint statement on the role of pharmacists in tobacco cessation. And this statement describes a number of ways in which tobacco control programs and pharmacy associations can work together towards the aim of develop and implement plans to engage more pharmacists in advancing tobacco cessation. And this joint statement was presented during the FIP webinar, Leveraging Pharmacists for Tobacco Cessation, New Policy Tools, Evidence, and Success Stories. During this webinar, Dr. Vinayak Prasad, head of the WHO No Tobacco Unit, said that this statement calls for a collaborative effort among healthcare professionals. Specifically, it advocates national action to empower all pharmacists to routinely provide tobacco cessation support. And Dr. Prasad added that if every pharmacist identifies and advises just one tobacco user to quit each day, this collective action could reach over 4 million users in a single day. At this webinar, FIP also launched the Global Intelligence Report on pharmacist-led tobacco cessation services. The full version of this report is only available to FIP members, but the pharmacist-led tobacco cessation services evidence of impact and country highlights version is available on open access. You can also have open access to the FIP Global Tobacco Cessation Service Findings infographic. I will share with you after my presentation all of these links on the chat. The basis for this report was established through a review of existing literature. In addition, a survey and also compilation of country highlights specifically tailored to engage FIP member organizations were conducted. And this report provides a comprehensive overview of the key role of pharmacists in tobacco cessation and how this can contribute to timely patient care and to health system efficiency through interprofessional care teams. The report also shares global best practice to advance pharmacy practice and international standards of patient care. Through June and July, we will be running a series of digital events focused on empowering pharmacists to support tobacco cessation, and today is the 5th of 6 events. We are also be working on a FIP statement of policy on the role of the pharmacist in establish a future free from tobacco and nicotine dependence. And this FIP statement of policy will be adopted by the FIP Council in Cape Town in September this year. So in conclusion, we know that the negative effects of tobacco use on health are well documented and established. However, giving up tobacco and quitting can be a challenging process, but the journey towards a tobacco-free life can be made easier with the right support. And we as pharmacists have an important role to play in helping tobacco users quit and also remain abstinent. So pharmacists' expertise and also accessibility ensure we are ideal providers of evidence-based advice, medication, and support to those who want to break their addiction to and dependence on tobacco. All of these program publications, event recordings, and other resources and tools are available on our microsite, as I said, ncd.fip.org. If you have any queries, suggestions, comments, everything is very welcome. Send us an email to ncd@fip.org. Thank you so much, and back to you, Lars-Åke.
Thank you so very much, Ines, for showcasing the resources we have within FIP when it comes to smoking cessation and nicotine cessation as well. I would say that it's a world of resources in this specific area, and we are also very proud of the ongoing, you can say, collaboration with the World Health Organization. We all need to collaborate in this area. It's very important. I would now like to ask our panelists to turn on your cameras because it's time for some questions and answers. Thank you so very much. We have got some questions here. I would actually raise the first question to Dr. Fu. What are the WHO recommended tobacco cessation interventions?
Okay, thank you. I think probably all of you are aware about on 2nd of July, WHO released our first clinical treatment guideline for tobacco cessation in adults. In this guideline, WHO recommends a set of comprehensive tobacco cessation interventions to help tobacco use quit, which include the brief device. We really have the evidence shows even just between 30 seconds to 3 minutes can also effectively help tobacco quit. The brief was part of any health provider's routine practice. Second is more intensive behavior support, such as face-to-face individual counseling, group counseling, and telephone counseling. And then third type of intervention are the digital tobacco cessation modalities, text messaging, mobile, the smartphone applications, artificial intelligence-based interventions, and also internet-based interventions. These are all can be recommended for tobacco to use in as like how to say combination or individual. The last one is the pharmacotherapy. We recommended 4 types of medication: nicotine replacement therapy, varenicline, bupropion, and cytisinicline as pharmacological treatment options. I think all these recommendations we already heard from the country examples. Basically, yeah, all very much aligned with. Really, they recommend to emphasize I need to provide comprehensive tobacco cessation support to help tobacco quit. For pharmacists, at least, I think they can deliver the brief device 30 seconds to 3 minutes provide. If can do more, they can provide other necessary interventions as well. Over to you, Lars.
Yes, thank you so very much. I have actually follow-up questions to you at once. How can we make governments and national authorities realize and use pharmacists for smoking cessation services, tobacco cessation services? Because I feel that we still are not used as a resource for these national strategies.
Yeah, that's a very good question. That's why today the event is really, to me, is really the one I really like, because really focus on how to empower pharmacists to support tobacco cessation services. At the country level, I think the country really broadly, they need to have a tobacco control strategy, including cessation as a key component. Within the cessation, they also need to really have the action plan to have the concrete activity to be planned. And in this process, they should engage the national pharmacy associations. So I think with this way, with the joint developed action, they're able to, I think, at maximum level to engage pharmacists to advance cessation services. As we can see in the joint statement, just Ines mentioned, we have the statement, really emphasize the activity really need to be taken at the country level, tobacco control program, and the National Pharmacy Association need to jointly develop and implement the plans to engage pharmacists. Personally, I think one thing I would like to highlight is really how to train pharmacists to deliver the tobacco cessation interventions. Many of them will say, I want to do, but I feel not very confident to do that. I think it's really leaking to the training. They need to feel like they're able to do it. I think the training is one of the very most important activity as part of the joint plan.
Thank you so very much. Monica, you talked a lot about outsourcing of pharmaceutical services. And according to the literature, outsourcing of pharmaceutical services doesn't always produce favorable results. It can also be demotivating for the pharmacy team and make it difficult for the pharmacy to control the service, like the quality of the service. What is your experience in this perspective?
Yes, thank you for the question. Yes, I am aware of these advantages in the literature, but my experience is the opposite and very positive. Although our service is outsourced, we don't just provide the service. We integrate the pharmacy team and involve the whole team in the service through training and feedback on the results, and we encourage the whole team to improve their clinical activity. So I think that makes all the differences. Yeah.
Thank you. Fiona, you mentioned a lot about the programs in Scotland and how they have been so successful, but how actually do you identify the different clients?
Sure, thank you. Yes, clients can be identified in a number of ways. Sometimes it can be from opportunistic conversations within the pharmacy. If a patient or a client is asking to purchase nicotine replacement therapy, or during a consultation about another health intervention, a question about tobacco use may come into the conversation, and they can be introduced to the smoking cessation service that way. They can also be referred from the specialist smoking cessation service, or indeed a general practitioner or other member of the sort of multidisciplinary teams within the NHS. So I think there's sort of a variety of options in how a patient may be signposted to come to the community pharmacy to access the service.
Thank you. A follow-up question. You have a very successful minor ailment scheme in Scotland called Pharmacy First.
Yes.
Is tobacco cessation services part of this minor ailment scheme or Pharmacy First approach?
So the community pharmacy contract in Scotland includes a number of different components, if you like, and the smoking cessation service sits within the public health part of the Scottish contract, and then Pharmacy First is separate. But all of these treatments and services are free at the point of access for the general public who are accessing community pharmacy services. So it is within the core element of the contract. It's probably just a nuance of the contract itself as to which part of it is labelled, but it's officially a separate part. However, for the patient accessing the community pharmacy service, there's no differentiation to them.
Excellent. Thank you so very much.
Thank you.
Björn, we saw on the slide presented by Dr. Fu that Germany is in the sort of blue range of one of the slides, having quite a high burden of smoking prevalence. Why do you think what are the main reasons you think that smoking prevalence is so high in Germany in comparison to other countries across Europe?
Yes, thank you for the question. So I think a bit was already mentioned on the slides that I presented in this regard. So I think that there's just not enough dedication at the moment to really regulate smoking from policy angle. It's particularly politically complicated for parties to come to an agreement in regards to bringing legislation to life that help, prevent or induce smoking policies on a more stringent ground. So if you have three parties from different political angles that negotiate on these terms, then it's problematic sometimes to come to a conclusion. Specifically, there is a narrative that sticks in Germany for quite some time, and that's that you have to be liberal. You have to be, you have to be allowed to do whatever you like. So it's a, it's a kind of, if you start regulate smoking, then the presumption is, from the political point of view, that people get offended by getting regulated in these regards. But for me, it's the opposite. It's the freedom not to, do whatever you like, but it's the freedom to support patients that are addicted to come away from their addiction and, be free from the addiction. That is a more liberal thought on how to regulate this. So, these are kind of the foundational situations, and hopefully now, as I mentioned in the later part of my talk, there is a momentum in politics that this needs to be advanced, and that the framework convention from the WHO needs to be addressed more prominently, because other markets like the UK or Sweden or Canada or so on, they are advancing quite quickly in support for patients. And so I think that in the German government, hopefully there is a recognition at the moment that this needs to advance quickly as well.
Thank you so very much. Yes, I agree. We have been quite successful in Sweden, but still there is a challenge, and they actually discussed it the other day on TV, because the tobacco industry is actually approaching young people via social media platforms and have very smart campaigns, etc. So, Dr. Fu, how can we cope with this development? There is a new channel to reach out to all the young people in the world. And if they start with 16 and continue to smoke for 31 years, that's a big problem. So how can we cope with this challenge? I think you're muted.
Sorry. Yeah, I think this is a very important issue. I think, as you mentioned, we need to work together. Yeah, from the cessation service delivery perspective, as I mentioned in WHO newly issued guideline, we recommend using the digital modality to reach large number of tobacco users. For this kind of a channel or this kind of innovation is very much easier to be picked up by the young tobacco users. I think this is one. In terms of raising awareness and also changing how to say, prevent them to use these harmful tobacco products or nicotine products, I think the campaign done through the social media, etc., is also something we need to consider. WHO have some project collaborated with the social media company or technology company for that. So we will see whether we're able to gain some experience to share with the rest of the world. over to you.
Yeah, thank you. Yes, perhaps we have this German example as a good example when you actually reach out to children, early children in school, because children tend to say to their parents what they should do, at least when they are still about 7 to 9 years old, perhaps. But still, it's important to educate them about the risks of tobacco, etc. Back to you, Monica. When it comes to the services in Portugal, are these services paid, and by whom? And is it by the health service or by the smoker, him or herself? And what about the medication when it comes to nicotine replacement therapy? Is it reimbursed?
Okay, thank you very much for the question. The service is paid for by the smoker to the pharmacy. The medication is currently not reimbursed by the health system here in Portugal, and this is also paid by the smoker. So a few years ago, Varenicline, prescription-only medicine, was reimbursed by the health system in Portugal, but it's now off the market and is no longer an option. So nicotine replacement therapy is not reimbursed like Citizen. So this is the situation here.
Thank you. What about in Scotland, Fiona?
Yes, thank you. So there are sort of two elements to the remuneration for the community pharmacy service as part of the contract, part of the support points in the 12-week journey. I noticed, Monica, your journey is 12 months, ours is 12 weeks, which is much shorter. And at weeks 1, 4, and 12, an intervention is recorded in the system, and that automatically schedules payments for the community pharmacy to undertake the service. And then there's reimbursement for the NRT products, which comes through a separate claim system. So yeah, so it's reimbursed by the NHS in Scotland to the community pharmacists, and patients don't pay anything for the service. Thank you.
Excellent, thank you. Björn, what do you think would be the main drivers and barriers for the provision of tobacco cessation services by community pharmacists in Germany? I know the government has invested quite a lot on pharmaceutical care services, etc. But are there still barriers and, of course, opportunities as well? What do you think?
Great question. Thank you. So yes, indeed, pharmaceutical services is a good opportunity for the pharmacist in general in e-community practices to come into a dialogue with, the patients. And so if we would implement pharmaceutical services on tobacco cessation or smoking cessation, that would help significantly to drive not only the awareness but approach. There is data that shows that smoking cessation with drug usage is effective, obviously, but there is on top, if you take a doctor or a pharmacist consultation on top of the drug usage, then the outcome is even better. It's like 20% better or something. So, the patient and service provider connectivity helps a lot for the patients to go through a lengthy program, and stay on track with being smoke free. So a pharmaceutical service has the opportunity that it defines a guideline that talks to the quality requirements that needs to be addressed by the pharmacist, but also the price that is regulated for the service that the physician or the pharmacist, in this sense, it will provide. At the moment, there is no remuneration, neither for the physician or for the pharmacist. And therefore, to address a patient on top of the limited time that you have anyway for the specific topic that the patient comes to your pharmacy for, that is then limiting the approach. So, the remuneration of these services will help to drive the approach and the consultation, obviously, and then certainly also the outcome.
Thank you so very much, Björn. Ines, we have heard excellent examples from 3 different countries, Portugal, Scotland, and Germany today, and also the support that the World Health Organization provides to their member states and also in collaboration with FIP. But from an FIP perspective, how can we best support and encourage our member organizations as well as individual pharmacists around the world to provide these services? We know that there is still so much to do. So what can FIP do to support?
Thank you very much, Lars, for the question. There are several key strategies, and I can first tell for the barriers that we have found during when we are drafting the report and receiving comments from our member organizations from around the world. One of the main barriers is the lack of training and knowledge from the pharmacists. So first of all, it is essential to provide comprehensive and ongoing training programs that equip pharmacists with the latest knowledge and skills in tobacco cessation strategies and counseling techniques. In addition, the development and dissemination of evidence-based resources, toolkits, and guidelines tailored for the use by pharmacists in their practice will greatly enhance their effectiveness. Also, advocacy for supportive policies and funding, it is essential at national and international levels to integrate tobacco cessation services into routine pharmacy practice. We saw 2 different scenarios. In Portugal, the patients need to pay by the pockets, and in Scotland, everything is paid. So we need to have more balance and more equity. And also, we need to facilitate platforms for knowledge exchange and collaboration between member organizations, enabling them to share best practice and also successful initiatives like these webinars where we can share best practice. Also launching global and local campaigns to raising public awareness about the role of pharmacists in tobacco cessation and the benefits of quitting will strengthen our efforts. Also promoting and supporting research into the effectiveness of pharmaceutical tobacco cessation services and disseminating the results will also help to continually improve the practice. And also by focusing on these areas, we hope to increase the capacity of pharmacists worldwide to provide effective tobacco cessation services, contributing to improve public health outcomes.
Thank you, Ines. I think we are almost running out of time, so can we please return to the slide deck? Yes, I would like to thank our speakers and panelists for excellent presentations today and for sharing your wisdom and experience with us. It has been a most valuable session. And I think that pharmacists hold a pivotal role in healthcare systems because we are one of the most accessible healthcare professionals in many communities. And given our extensive knowledge of medications and health, I think we are uniquely positioned to take action against tobacco use and intensify our efforts in tobacco cessation. And we have heard today also that tobacco use remains one of the leading causes of preventable illness and deaths worldwide, contributing to diseases such as cancer, heart disease, stroke, and chronic respiratory conditions, etc. So helping individuals quit smoking can lead to immediate and long-term health benefits, such as improved lung function, reduce risk of heart attack, and lower chances of developing cancer. So we can provide tailored advice, support, and we have resources to individuals attempting to quit, making a profound impact on their health outcomes. So I think if we summarize it, it will lead to improved health outcomes, reduced healthcare costs, enhanced quality of life, strengthen public health, for example. So in conclusion, I would say that pharmacists need to take action now against tobacco use and intensify our work in tobacco cessation due to the profound health, economic, and societal benefits. So thank you, all of you, for your fantastic contributions. And this event is recorded and can be found at events.fip.org, as many other events as well, and upcoming events. So please check our website to find out about new digital events. Next slide, please. And I will also encourage you, if you haven't done it yet, to register for the World Congress of Pharmacy and Pharmaceutical Sciences in Cape Town, where we will discuss about innovating for the future of healthcare, of course, benefiting our patients, because we are here for our patients. Next slide, please. And you can see that we have 3 tracks on this Congress: equitable quality healthcare, innovative drug discovery and access, and revolutionizing healthcare with AR. And these have also more or less been covered today, but on a briefly perspective. So if you want to learn more about this and also co-create the future of pharmacy and healthcare for the benefits of our patients, please join us in Cape Town. So by that, I would like to thank all of you for attending, and a special thank you to our speakers and panelists for sharing your experiences and wisdom. And also thank you to the FIP staff for all fantastic support today. So by that, I will like to close the event and thank all of you for attending. It has been a great pleasure for me being your host today, and I hope to look forward to meet you soon again in the future. So thank you so very much, and I wish you all a pleasant evening. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.